My name is Victoria Sherry. I'm an oncology nurse practitioner at the Abramson Cancer Center at the Hospital of the University of Pennsylvania Medical Center, located in Philadelphia, Pennsylvania, where I specialize in thoracic oncology. The use of standard of care concurrent chemoradiation as recommended by clinical guidelines can optimize outcomes and give patients without disease progression the opportunity to receive guideline-recommended immunotherapy. It's important to manage adverse events proactively for patients who are receiving concurrent chemoradiation because we know that chemotherapy sensitizes the radiation and can add to the acuity of the toxicity. So proactive management can actually mitigate those adverse events, which is key, because research has shown that patients who have missed doses of chemotherapy actually have a higher mortality rate. There are a whole other array of adverse events that patients may experience during concurrent chemoradiation, including constipation, which usually stems from the antiemetics that we're giving them pre-chemotherapy. Things that they can do to help mitigate the constipation include drinking fluids, activity, so moving around, and if they need to add something in to help their bowels start moving, they could add in Senicides or Miralax. They should not go any more than 3 days without having a bowel movement, and they should contact you if that's the case. Patients could also, on the flip side, have diarrhea. In order to manage the diarrhea, we again want to make sure they're staying hydrated. They may or may not need IV fluids to keep them hydrated. You want to check their electrolytes, and you could also institute antidiarrheals after, of course, of ruling out infectious processes such as C. diff. And then nausea, vomiting can also occur, although I think nowadays we have such great antiemetics that it's almost a moot point. But it is important for all of your patients to have an anti-nausea such as prochlorperazine or ondansetron at home in case they do feel nauseous. Radiation dermatitis is another AE that we manage very closely. From day one, I have my patients put lotion on their entrance site of the radiation and their exit site. A lot of patients forget about that exit site on their back, or they can't reach it. So it's important to let their caregivers know also that they should be putting lotion on. And when I say lotion, it should be a thick emollient. It should be in a tub that you can scoop out, not in a cream that you can pump out. You want to remind the patients that they should wipe off their lotion prior to radiation and then again apply it liberally on immediately after each radiation dose. I tell them how important it is to stay on treatment as much as they can. And I think the key thing here is that they know that I'm on their team and that I'm here to support them to get them through the treatment. They can't do this alone, and they don't want to do it alone. And they have their radiation oncologist, and they have their medical oncologist, and they have their nurse practitioner, and they have the nutritionist and physical therapy, and we have so many resources for them. We can get them through this.